Mark.
So happy to take any questions, and again, with the one criteria of respect and responsibility that we have to patient privacy. I imagine many of you want to know who she is, how many people she is in contact with, where she works, and those clearly are understandable questions, and I hope you, in anticipation of our responses, understand our patient responsibility to protect and preserve confidentiality, but know that we are intimately involved in answering those questions with the kind of specificity that's required at the moment.
Governor Jody Hernandez, NBC Bay Area. Can you tell us when this person came to the Northern California hospital? How many days went by before they came to the medical center and, you know, were possibly exposing folks?
Yeah. I leave that to Dr. Galley.
We can't give all of the details that reveal that. We know that there were a number of days that she was in her community and that she then did begin accessing care, and through the course of her care, as her condition evolved, she was then tested. So there were days in between when she emerged with symptoms and when the test actually occurred, but we have been working closely with those healthcare delivery systems that took care of her, as well as the CDC and others, to make sure we're doing all the appropriate things to understand what community exposure existed and what we can do to make sure those who were exposed receive the right care and concern that we would want any of our family members to receive that were in that situation.
I should just note, it underscores the importance of the testing protocols being advanced, and as we said, the information we received from the CDC this morning advanced those protocols, and so we are satisfied and we're now moving in the right direction. Accordingly, we have a tracing protocol that's best in class, meaning every single point of contact, every point of contact of those that were in contact, all of those will be resourced and reviewed. Accordingly, CDC has committed to sending 10 of their personnel into the state of California to help assist in those efforts to broaden our capacity to track each one of those individuals and to make sure that they're contacted and to make sure that they're interviewed.
Governor, let me ask you, there were many of the passengers from the Diamond Princess were brought to Travis Air Force Base in Solano County. Many have tested positive. That's where this patient first presented. Is there any connection?
Leave that to, again, my medical team.
We have no evidence that there's any connection with those patients and this individual at this time.
Okay, and you're also tracking a lot of individuals. How many potential contacts are you tracking right now?
I can't give you those specific numbers, but I can tell you that investigation started yesterday. They continue across the full spectrum from the individual's home all the way through the hospital system, and all of them are being reviewed carefully by those people in the field at this time.
Characterize it, dozens, hundreds?
I can't give you the number at this time.
Governor, can you explain why the state wasn't prepared with more testing kits?
Well, no state was. No state had the ability to access them. Well, I don't want to get into the, but let's just establish this. New protocols are now being advanced. They can't happen soon enough. Testing protocols have been a point of frustration for many of us across the spectrum, and I mean, means across not only spectrum within the health system, but across states. We have, as I said, just 200 kits, and that's for not just the traditional diagnostic, but also surveillance. It's simply inadequate, but no longer will that be the case. Later this afternoon, tomorrow, next few days, we have been assured of our capacity to significantly, exponentially increase the capacity to test, and this is something that, again, is critical at this moment.
So, Governor, has the federal government been too slow to respond? I mean, UC Davis tried to test that passenger last week.
I don't, look, I'm not going to politicize this moment, and I'm not going to point fingers, and I'm going to speak honestly and forthrightly that we have had a very strong working relationship with the administration, from the secretary level to the director level. We have been in consistent contact, not only as a team, but individually, I have as well, from day one. And to the extent that they are processing their own protocols and procedures, we are grateful that in that iterative engagement, they are moving forward as we demand in advancing our efforts to test.
Governor,
Are
with
there
that,
more?
Governor,
Current challenge, will you declare an emergency? Because it is a challenge because
To the extent necessary, emergencies often are to emphasize energy of focus, often just for federal purposes of receiving additional resources and support. Right now, I don't feel either are necessary. The attention is understandably focused. The money is not the issue at the moment, but to the extent conditions changed, we'll consider that.
Governor, with everything going on, how concerned are you about proposed cuts to the CDC?
I'm not concerned about them at all today. I was very concerned about them a week or two ago. I don't think the issue of money now is going to be an impediment. I think there is a deep sense of urgency and recognition that we need to provide the kind of resources to meet this moment. So no longer am I concerned.
Following up on that, you mentioned that relationships and trust matter more than anything. Do you trust that President Trump is taking this seriously enough?
I know his team is. I know the folks that came up after him in the press conference. We know each and every one of them, not just by name and face, but by constant contact. I know each and every one of them are sincere and resolved, and so I have absolute confidence that the folks he's assembled around him do.
Governor, about President Trump himself?
We'll see what he's able to accomplish in the next few days and weeks. But look, it's all about your team. It's about the people you assemble. And he's got long-term professionals that have transcended his administration that are there, that have earned reputations that are solid. And we have developed relationships of trust, and those relationships predate his administration and mine. So from that perspective, not a lot of daylight. Again, I'm not here. It's very easy for me. I mean, we're involved in 68 lawsuits with the Trump administration to find daylight and politicize this. But first and foremost, I'm an American citizen. I'm a father of 4. Politics has no place at this moment. We have to meet this moment with a sense of urgency and conviction that transcends politics and transcends pettiness. And so I will not allow my administration to participate in that, and I hope we collectively can elevate above that.
Governor, you said more kits are on the way, more testing kits are on the way from the CDC. When will they get here, and how many kits are expected?
Well, that's a real-time
Sure.
question.
We spoke to the director of the CDC moments ago, and he assured us, without giving a specific number, that our capacity would be substantially expanded. We expect that those kits will be here any day now, and we already have a number at the moment, so this will just augment that capacity and scale very soon.
How many people are in current contact?
Are there more clinicians who have requested that their patients be tested, but they haven't because they haven't fallen into the narrow protocols?
We don't have that information. We do not know if that's actually the case. But as the governor said, we are in constant communication, and the case from yesterday is obviously giving the CDC a lot to consider in terms of revising those protocols so that more individuals will be tested with symptoms that might be identified as common pneumonia without a clear source, and we are in conversation with the CDC about ensuring that that fits the need for California so that physicians or clinicians who ask for the test will more easily be able to send it.
Doctor, you mentioned that this woman spent some time in the community before she recognized any of these symptoms. What specific community are we talking about here? Who should be concerned?
Yeah, so as both the governor and Dr. Angel said, we won't be speaking about the specifics, but because we have...
People deserve to know if that individual was in their community?
We have a very robust and first-class tracking system to ensure that we're reaching out to all of the potential contacts in many, many different walks of this person's life so that we're doing, as we have in many, many other situations like this, to ensure that those individuals who may have been at risk are contacted and that they receive the correct attention and care if
But
needed.
you don't feel the community deserves to know?
As we said, we're engaging closely with that community, and in order to protect a number of things around the public health standards that we're all committed to, that we are working hard to make sure that anyone who might have been in contact with this individual throughout the community is knowledgeable, and that we're reaching out to them.
And let me just amplify, if I may, just briefly amplify. Absolutely, people that have been in contact with this individual have the right to know, and in real time, they are being interviewed. Points of contact, family members are being interviewed, and others. This is a very detailed protocol that is well established, that predates this particular virus, and it is a protocol that is multidimensional, and I think affords a level of comfort that people understand we're meeting the moment in a comprehensive and detailed way.
But this is under the assumption that someone else in this community transmitted this disease to that individual. We don't know who that person is. So should people who didn't necessarily contact the sick person know that there are other people in their community who may have this disease?
Yeah, but look, that's the reason the testing protocol is so important. You don't know what you don't know unless you're testing. And so this point cannot be emphasized enough. We should have caregivers, doctors, have the capacity in real time, on demand, to advance these testing protocols. And that's, I think, that's why I began this conversation today with all of you, that's our top priority. It was this morning, and we've been given assurances that CDC recognizes that with a deep sense of urgency. As you know, it's one thing just to have the testing kits. It's another to have the capacity on the back end to adjudicate the facts and have a full diagnostic test that's provided. That's limited today. But over the course of the next few days, we've been given assurances there'll be exponentially more sites for testing also made available, including the prospects of doing them within the state of California, so we get the test results back
So
more
should
quickly.
everyone in Solano County be concerned?
Look, everybody in this country is rightfully anxious about this moment, but I think they should know that we are meeting this moment with the kind of urgency that is necessary. And I don't want to overextend the anxiety that people naturally face. That's common sense. This is something that we're organizing around, something we've been organizing around for months. Nothing so far has surprised us. Nothing. What happened in Solano County did not surprise anybody. I think the only thing respectfully that surprised folks was that it didn't happen sooner. But we had anticipated this moment. It's a natural thing. And invariably, we will meet it. And so I think people should go on their day-to-day lives with some common sense. And I think Dr. Angel was right to advance with common sense. It's nothing more complicated than what your grandma taught you, your mom taught you, and others. But I don't want to instill any sense of new anxiety that already is naturally filtering through our communities.
Since
Do
the
you agree
virus
with
can
moving
be
patients to Costa
spread,
Mesa? Do you
sorry?
agree with moving patients to Costa Mesa, and are other sites under consideration?
We are in litigation, as you know, in real time on that. I think both parties are meeting, representatives, lawyers from both sides. So I don't want to speak to the specifics of the site in and around Costa Mesa community, but we clearly have protocols, and we have pre-identified locations, and that's among the more favored location in the state, but there are other sites in addition to that site, all across the state.
Governor?
All across the state.
An update on the number of people that need to be isolated and put in a place like the Costa Mesa?
It's a number that's very dynamic. We estimated it, candidly, forthrightly, to be higher than it turned out to be, meaning the test came back more favorably. And this is something that's encouraging. Less people testing positively than we had anticipated. So we had some initial estimates of what we needed that actually are substantially more modest. That said, this is dynamic, and things could change in the next days and weeks. And so a big part of why the Director of Office of Emergency Services here is we have protocols that are well established as it relates to emergency planning and how we address people that not only can shelter in place in some respects and be quarantined at home, but also those that need stepped up support, be it in hospitals, but also in non-hospital settings, so that we don't clog our hospital system and not provide access to those that are in desperate need of emergency care and other acute care.
Governor, you and the Secretary have alluded to this, but do you specifically think the guidelines for testing need to be expanded? And he mentioned something that's happening first in California. If you can expand on that.
Yeah, no, look, as I said, can't repeat it enough. We need to substantially increase access and availability to testing, and we need to do that today.
What the guidelines?
And the guidelines, as it relates to the testing, I'll leave to the doctors and the experts, but I can assure you, I think we all share that sense of urgency that the testing protocols need to be improved.
So in conversations with the CDC today, we are assured through our feedback and feedback from a number of other states and jurisdictions that those requirements for testing will be changed based on the new information from yesterday here in California, and we are working hard with the CDC to ensure that once those are prepared, we are ready for it. We know that it will shift from the posture of border and significant containment to one where we acknowledge that community spread is possible and that it meets that condition, so that patients where the provider believes there are symptoms suspicious of coronavirus, that we have the capability and permission to be able to send that test.
I think about what kind of notifications people in Solano County are getting. People are getting reports, getting emails, text messages. What is the general public hearing about this? I mean, they're talking about schools that are wiping down desks. What is the general public getting out of this?
Dr. Andrew?
Sure. So the contact tracing itself and the way we communicate depends upon the individual and how we can best reach them. So that can vary in different methods. So that's the first answer to your question. With respect to schools and other locations, that really depends upon where we understand there might be a particular risk. And so that, again, will be evolving over time.
Do you
But
plan
is
to
this something
release?
going out to the community at large, though, or only specific people being contacted?
The way the way contact tracing works is that we start from the individual that we know has been affected. We have interviews with all of those individuals that are around them, and step by step, we look at where they've had, where they've been, and who they might have been in direct communication with. We also know, because this person was admitted to the hospital, that we also look at all of those individuals in the hospital who might have been in contact with the
Do you plan to release
But I just want to
timeline?
be clear in terms of that, though. There was nothing that went out blanket to the community. If someone got contacted, it was part of the contact tracing, not a general, emergency alert on their phone or something.
No. These are personal and direct to the individuals, and very intentional, because we really want to make sure that we communicate to those individuals the potential risk that they have when we identify it. So these are not blanket statements, they're very specific.
But do you plan to release a timeline of where this person has
in a
been?
grocery store, for instance, and you don't know all the people
Exactly.
that she might have come
Guys,
across.
I can, having had the privilege over decades now, not just in this instance, these protocols are well established. This is not our first great challenge as it relates to public health. Quite the contrary. These protocols have been perfected in so many ways, shapes, or form, not only in the United States, around the rest of the world. So all of those things are being considered, I can assure you. And we have not only existing teams and protocols in place, they are now, as I suggested, being expanded by the CDC themselves that are help amplify those efforts. And as information becomes appropriate to make available in a way that doesn't overly create anxiety and, okay, I mean, guys, let's put this in perspective. I know there's deep anxiety, but let's put it in perspective. As we feel it's appropriate for public health purposes, we'll make all of that available. I am deeply committed to transparency, and I'm deeply committed to building trust. And so we're not going to hold things back inappropriately or politically. There's no happy talk here. I'm not trying to talk something up or situationally worry about the politics of this. We are dealing with this as a public health issue. And above all else, that's our frame and focus, and people, again, should know we're on top of this.
You're saying for them to trust you, but there seems to be a resistance up there among you guys to say where this individual has been and when. Why is that?
For all of the reasons I just stated.
Governor, concerns about healthcare workers being exposed both at Davis and at the First Hospital.
Correct. And we are aggressively working with those caregivers. We've identified the vast majority of them, and to the extent they had contacts, they are being identified in real time. These are the pros and professionals, and most of them are self-identifying, and we have procedures in place. And again, remember, quarantining people, isolating people, happens all of the time.
Governor,
From measles to TB These protocols are well established. As I said, H1N1, all these other challenges we've had in pandemics in the past, these protocols have been advanced, and these are similar strategies for engagement that we've had and protocols that have served us well, both from public confidence perspective and from a public health perspective.
At the first facility that
You
the patient was
better believe it. Every point of contact
Is that facility still
has now
accepting
been.
patients?
We are. Well, I believe they are accepting patients.
And which hospital is it?
Additional testing kits that you expect to get, has the issue with early faulty tests been resolved, and are there sites in California that you expect?
Not I wouldn't categorize them as faulty tests, just inaccessible testing protocols. And so we are getting, we have just received, as I said a few hours ago, assurances that tests will be forthcoming, additional test kits. Again, 200 seems remarkably inadequate. Of course, the real inadequacy is not just the lack of test kits, it was lack of ability to utilize those test kits. Now we'll be able to utilize them, and we will be the recipient of an exponential increase in new test kits. And then more testing locations will be made available, so we don't have to send everything back to CDC headquarters in one testing location. We'll see multiples of locations over the course of the next few months.
What about money? The federal government underfunded this, and is there
I'm not worried about money.
What about the state? Is the state gonna
I'm not
spend
worried
more
about.
money?
I'm not worried about resourcing this response. It's just not even
Does the state of
concern.
California plan to put more money into this?
We will meet this moment. We are well resourced as a state. California, for those of you not familiar with the state, is running record reserves and running surpluses. We are uniquely resourced in California, and I have great confidence that the administration, particularly in partnership with Speaker Pelosi and leadership in the Senate, will provide more than adequate resources to the state of California and other states.
Thank you all.
Excuse me,
Thank you all.
I'm-
Thank you both.
are actually running short on some supplies like masks. Can you talk to that?
Yeah, and I'll end on this because we can spend the day together. You've got a lot of work to do, as do we. As it relates to the masks, we have millions of masks. Some have expiration dates, and we're making a case. Some of these masks have been well stored in secure, cool facilities, and those expiration dates that do not exist in other parts of the world should not necessarily apply here. We have orders for masks. This shouldn't alarm anybody. The masks, of course, are produced disproportionately in China, and so